Professor Alexandra van der Heever, Chairperson of Social Security at the Wits School of Governance, joins us now to discuss the repeal of mask wearing in the country. Prof, thank you so much for your time this afternoon. Now, is this the right move for government, considering that South Africa has only administered roughly 36 million vaccines in the country?
Yes, it is, because the public health value of the restrictions are no longer merit them. It doesn't mean that the removal of these restrictions don't involve individual risk, but the general protection of the public is not going to be served by these restrictions, and the continuation of them with so little value will just result in many people just ignoring them. So I think it is time to get to move away from them, and we probably could have done it a few months ago already. But in terms of going forward, people who feel at risk, have comorbidities, and are concerned should continue to be very wary about public spaces and protecting themselves, and should continue to wear masks when they feel unsafe, or if they go to restaurants or crowded settings, try to be in well-ventilated venues. So I think going forward, we are going to be living with this virus as we do with many others. It's now endemic. We're all going to get infected multiple times. And there will be people who will still die from this, but and hopefully the vaccinations will improve over time. It's also important to note that a lot of people have been infected even if they weren't vaccinated. So it's estimated that more than 90% of the population has been infected. That's even on top of the people who've been vaccinated. And many people have been infected multiple times. So the level of immunity against severe illness is already high. Although it does wane, and that's where people should be sort of wary over time.
Now, I don't know if you've been listening to just some of, those interviews with various South Africans, being interviewed in terms of how they feel about it. Of course, much relief for many South Africans. But of course, one or two have said that they've got mixed feelings about it, whether to wear the mask indoors in certain avenues or not. I think largely the confusion is around those new variants, those new waves that we've been seeing in the past. So what is the key driver of basically, repealing some of these regulations now in the country? I know the minister mentioned, that the daily COVID-19 numbers have been going down. What else are some of the signatures that we are seeing in this country?
Yeah, so first of all, I don't think it's the daily numbers. Those are, at this point in time, largely irrelevant. When the virus is endemic and you have high levels of accumulated immunity against severe illness, the main issue is how many people are getting severely ill and dying. And those numbers are now very small. They're not zero, but they are very small. And so the issue is that we're going to face waves. We're going to face surges as we do with flu. We don't always detect all of them because probably the whole testing regimen will decline, with people only who develop severe symptoms getting tested when they come forward for treatment. So we won't see the levels as we've had in the past. They will just not be visible. So that's not the driver. The driver is essentially low levels of severe illness. The emergence of variants is also with us. All viruses of this nature adapt all the time and change all the time. So there will be changes. The question really is whether you have that adaptation in the virus results or mutation in the virus results in increased severity of illness and not just increased infectiousness. So I don't think we've seen that yet, and we haven't seen it really escape the accumulated sort of immunity against severe illness that is built up. What we're probably not sure of at this point is just how long the immunity from severe illness lasts from prior infection and vaccination. It does appear to wane. But I think that this is really where we will see just a sort of relatively high-risk individuals getting revaccinated on a regular basis, and really in high-risk settings for people who feel vulnerable, they are not prohibited from wearing a mask if they wish and protecting themselves. They should just make sure they're wearing a mask that does actually offer protection, because a lot of cloth masks and surgical masks don't. So an N95, for instance, will be effective. So people who feel vulnerable should continue to protect themselves. And I noted that in some reports, taxi drivers are concerned and feel vulnerable. Taxis can also drive with their windows down, and they can ventilate the taxis and improve their risk status as well if people feel concerned.
Now, Prof, of course, it's been a 2-year journey with many lessons. Just looking at some of the global trends and what we know about COVID-19, 2 years down the line for South Africa, of course, in some countries, relatively, since 2019, towards the end of 2019. What are some of the key lessons that South Africa can take, just from even the handling of COVID-19 and new diseases or pandemics that hit our shores?
And I think we're going to have to learn how to develop and produce vaccines very quickly. This could happen again in the future. Again, this virus is still with us and it's not gone and it won't go away. But we do need to be able to develop vaccines and make them available very quickly. If we end up with essentially a very new virus that comes in, that spreads very easily and has a high level of severity, if that's the case, it's the most dangerous scenario we have, and it's likely to recur. So we should be able to respond to that as fast as possible. That means adapting regulatory measures, because trials, for instance, take a very long time to come through, and regulators can basically hold up a vaccine for quite a while they wait for evidence to come forward that it won't be harmful or is efficacious. What we need to be able to do is to have those processes happen much, much faster. I think we did really well internationally in getting vaccines ready in this particular pandemic, but we also didn't have vaccines available in South Africa soon enough. And so we need to also make sure that we're able to accelerate the purchasing, the procurement and distribution of vaccines. We've done it now once. I think this is a real test. And I think that South Africa, having done this once, we can mobilize very fast if we have the vaccine and if we've procured it. And that's a good thing. The other aspect is treatments. I think we do have to begin investigating therapeutic options faster. If you look at this, we didn't have a lot of therapeutic options anywhere through this pandemic. And in future, that can also be very important in mitigating the harm of the infection. So again, all of these require that you've got expertise in developing and then mobilizing a therapeutic option or a preventive option as quickly as possible. We did also find that, the issue of getting testing up fast, to be able to use test and trace, basically the systems got completely overwhelmed, and it wasn't actually a very effective method of prevention, whereas it would have been the traditional approach to prevention in the absence of any kind of vaccine or treatment. And so we've also got to look at domestically producing, for instance, reagents, etc., for testing, so that we can actually react much faster than we did on that side. We were very, very slow on the ground to actually detect the spread. And so we need to be able to be a lot more broad-based. I don't think we need to go to the extent of a China where it locks down a whole city and tests everybody there for 4 days. That I don't think is a very practical solution in the future, but we do need to have more testing capacity faster and more strategically used, and possibly invest in better options for test and trace, for contact tracing people. But yeah, a airborne virus like this spreads so fast that it actually overwhelms many traditional public health measures.
Professor Alex van der Heever, thank you so much for your time this afternoon. Really do appreciate it.